Hi, my name is Dr. Vera Tarman, and I am an addictions physician working out of Canada. I'm excited to share my experience using the Freed Medical Scribe program and how it has positively affected my medical practice. About 6 months ago, I went through a very stressful investigation by the College of Physicians after a patient complaint. It was a busy clinical day, and I had urged this complicated patient to go to the ER based on their symptoms. However, they refused to go. In the rush of the day, I forgot to document that I had recommended the ER and the patient's refusal. The complexity of their issues meant that I focused on what I could do at that moment, next steps, and I neglected to document the refusal. This lack of documentation came back to haunt me during the investigation. While it was ultimately resolved in my favor, it was an arduous process that could have been avoided if I had properly charted the encounter. It was an eye-opener for me on the critical importance of thorough documentation, even on the busiest of days. We always hear it, document. I took the course that the college had offered on how to document properly, wondering all the while how I was expected to do all of that in a busy day where I might see as many as 20 patients in a clinic. Around this time is when I learned about the Freed Medical Scribe program. This is a program that uses artificial intelligence to automatically listen to the patient encounter, extract the relevant medical information, and actually generate a clinical SOAP note. You can even get the full transcript of the interview if you so wish. I have found this to be extremely accurate and customizable. I can get a document that's arranged for an intake assessment, as well as for a progress note. I can even train the scribe to write a note for counseling or psychotherapy where I don't need all of the mentions about medications and lab work, etc., because I'm talking about a therapeutic issue. After using Freed for about 6 months, I can say that it has been transformative for my practice. It has certainly reduced my documentation time. It is much quicker to adjust a note that has been prepared for me than to remember all the details after the patient has left the room, especially in a busy day when I'm not likely to remember everything. I just simply turn on the Freed app when the patient comes in. It is documenting while we're speaking and generates accurate, detailed notes as if I had written them myself. Most importantly, I am relieved that Freed ensures me that I never miss documenting critical negatives, patient instructions, and follow-up plans. Had I been using Freed during that patient encounter of 6 months ago, I would have had the clear documentation that I needed that would have made the investigation a non-issue from the start. Freed gives me peace of mind knowing that every encounter is thoroughly documented to a level that I would never achieve on my own, even if I had lots of time.